Getting started, I want to say a special thank you to Scott Scanlon. Many of you probably recognize his name. He's had a very distinguished career in journalism here in Buffalo. He was with the Buffalo News for a period of time. He covered a lot of different topic areas. He can probably even explain better himself, but including quality of life solutions, health reporting, science. He was actually a very key member of our planning committee here and made some great recommendations. So I want to thank him for being willing to moderate this panel for us today. The rest of our colleagues who are joining us, and I just wanted to make mention, this is a community-facing panel. As Dr. Bashir mentioned earlier this morning, we take very seriously the commitment that we have to improving the health of Western New York. And that's not just that work with or would like to work with, or actually that really round out the conversation today to make sure that you know about all the resources that are out there. So Susan Bagdasarian is a colleague of ours. She's actually from the UB Office of Human Resources. She is leading the Educational Assistance Program, where in her role she provides confidential support and resources to all of our team members, helping them navigate personal and work-related challenges. So she has assisted a number of different people across the university who are navigating the conversations that we're talking about today. Randy Hoke is the commissioner of the newly named Erie County Office for the Aging. Randy is joining us. His experiences in the aging field include serving as program coordinator for adult day services at Hamburg, recreation supervisor of senior services for the town of Hamburg, and Director of Recreation for the Erie County Medical Center Corporation at the Erie County Home. So Randy, thank you, and you got a shout out. I hope you were in the room when you got a shout out from Greg. Okay. Andrea Cook is joining us from the Alzheimer's Association of Western New York. A lot of times, especially even in the space that I'm situated here in the building, people just automatically associate that Alzheimer's and dementia are always related to aging, but so many times frequently we're talking with a caregiver who even some of the expertise that she brings could be setting in for a family much earlier than what is expected. So Andrea is the Director of Community Outreach, which means that she leads education, training, and community engagement efforts across our region. She works to raise awareness, support caregivers, and build partnerships that strengthen dementia care. And we're very appreciative that she was willing to join us today. Allison Lawson is joining us from the YMCA today. And as I mentioned earlier to one of our attendees who had a question about the child side of the spectrum, Andrea is Vice President for Healthy Living at the YMCA, and she leads efforts to promote wellness, community health initiatives, fitness programming, inclusive strategies that are meant to engage all people of different age ranges. And so she's going to be able to tell us about that as part of our panel today. And then lastly, I want to actually introduce Dr. Pinto, who is actually a UB alum, and we're very pleased to have her here today. She's the president and co-owner of Allwell, which is a Western New York-based home health care company specializing in services for individuals with brain injury and other disabilities. And she has a long and distinguished career in vocational evaluation and client and care and organizational development. So thank you as an alum for joining us to share your experiences. Including you. So with that said, now that Scott has fetched his own chair, and I apologize, one of the microphones is cutting in and out, so people online are having a hard time if it's not working, so you're going to have to share.
Can everybody hear me okay? Is this working?
Okay, try it now.
How's that? Can everybody hear up there? Okay, great. I'm going to start a little bit differently by asking if anybody else is overwhelmed so far. If it hasn't happened in your personal life, even here with all the information. And I'm going to talk for a few minutes because what I continue to do focuses on caregiving as well. I'm hoping during this panel that we can distill some of the most important information you've learned today and provide you with a clearer way forward to continue navigating as a sandwich generation caregiver. I want you to know there are a lot of resources available across the region that if you feel overwhelmed and concerned, you're not alone. You can do this, be courageous, and ask for help as you go. There are people who know how to navigate this path and can help, and they can help you stop and take a breather as you need it. So I was the Niagara County editor with the Buffalo News before I became the Western New York Refresh editor in February 2013. Did this work for 10 years covering health, fitness, nutrition, and family life in the Buffalo Niagara region. Much of that coverage involved caregiving and helping, and I continue to serve with the New York and Michigan Solutions Journalism Network. It's a group of media outlets in Buffalo, Detroit, and Rochester, funded mostly through the Ralph C. Wilson Jr. Foundation. You've heard Greg Olson talk a little bit about the financial pressures that we're facing as Americans when it comes to healthcare. Some of the foundations, including the Wilson Foundation, are covering some of those gaps, and caregiving is one of the areas. So caregiving is a humbling equalizer, regardless of your age, social status, or background. It's also quite common. AARP, and if you're not a member, I suggest you join if you're 50 or older, estimates that there's roughly 1 of every 5 adults is now a caregiver. It's grown nearly 25% during the last half decade, about 50 million people across the country. They spend an average of 24 hours a week with hands-on care, managing housework, finances, transportation for a family member or friend with a serious illness, developmental disorder, or disability. We've been feeling the impact across the country during the last 15 years as the 76 million baby boomers, including me, born between 1946 and 1964, began reaching retirement age in 2011. Members of this gray tsunami will continue to turn 65 at a rate of 8,000 a day through early the next decade, according to AARP. There will be more adults 65 and older in America than children by 2035, according to the U.S. Census Bureau. And the 85 and older population will likely more than double from 6.6 million before the COVID pandemic to 14.4 million by 2040. New York ranks 4th in the nation in terms of residents 60 and older, a number expected to hit 5.3 million by the end of this decade, accounting for 1/4 of the population in 52 of its 62 counties, including some here in Western New York. So a survey that we conducted with the Solutions Journalism Collaborative in 2022 in our coverage areas showed common threads in all 3 regions in terms of caregiving. Caregivers most commonly tend to someone who is bedridden, has mobility issues, or a chronic health condition. More than half of caregivers pay out of pocket to help those in their care. Spending is higher for people of color, sandwich generation caregivers, and those who spend more time each week providing care. More people report a mental health toll or both a physical and mental health toll compared with solely a physical toll when it comes to caregiving. So that's the big picture of caregiving. Participating in the conference today as a caregiver, you're going to meet 5 people now who can make your role a little bit easier. I'm going to go in order because all of these 5 have particular skills that can be helpful in various areas. Start with Susan, and then going right down the line. So Susan, I'm wondering what types of services can employees here at UB seek out for an employee assistance program tied to related caregiving responsibilities?
So us here in EAP. Okay, is that better? Okay. So we here at UB in the Employee Assistance Program, and there's myself and one other person, my colleague, Neil McGillicuddy. We assist employees as well as your family members in any of your caregiving needs that you might be struggling with. So not only do we provide resources and information and referrals to things such as assisted living, respite care, nursing home care, transportation services, home meal delivery. We can give you all those resources and information on everything like that. How to balance your life, your work, your family with your caregiving responsibilities. So we have a lot of tools that we use to help people that maybe are struggling with guilt or health issues of their own, and we work with them and try and find solutions in ways that it make their life a little bit easier, and whatever that means. We really have a lot of different ways we can go about doing that. We have physical exercises, we have mental exercises, and what works for one person may not work for the next person. So we try and just figure out, the best solution to help you going forward in your caregiving responsibilities. And lastly, we and I will tell you more information about that. But we also provide resources for caregiving support groups in the community. So if you're interested in joining a support group in the community, it's really great. Basically what they do is, share information, resources, support one another, and provide any resources that they may have found helpful in their caregiving roles. So if you're interested, anybody that maybe works at UB or your family members, again, reach out and I can give you more information on that. So thank you.
When somebody reaches out to your office, how long does it take when people come in saying, hey, I'm having an issue caring for a loved one at home, and I wasn't even sure if someone here at UB could help?
Yeah, usually we try
that, maybe they're even eligible for something like this?
Well, we try and get the word out there, as to what our services are to the UB employees so that they know that we're here. We have a monthly newsletter that goes out to everybody and, we tell them about the support groups. So hopefully if they're struggling, we're a resource that they know that they can come to. But yes, a lot of times, they come to us under a lot of stress or anxiety or whatever, and it's uncovered that it's because they've got so much on their plate. They're dealing with family caregiving responsibilities and then their job overload, and they're trying to find a way to balance it all. And then the guilt because they feel that maybe they're shortchanging something or they're not doing as good as they could be doing. So we try and work with them and talk with them and, uncover what's going on and, get them in a better place mentally, and then, see what resources we could provide to make their life a little easier too.
What do they tell you after a few weeks with these extra resources?
Usually they reach out and they're very thankful that, we've given them, because I think when they're going through it, they're so overwhelmed, they don't even know where to start. Like, where would I even call about, getting a bar in my parents' shower or something, and we can help them with that. Or, I think my parent, needs to go into assisted living or independent living, and how do we have the conversation with them? And we'll help them with that too, how to have that tough conversation. And, so we, just try to Ask a lot of questions, try to get to what their needs are, and usually, there's some relief on their end because it's a start, and we do utilize the Erie County Department for the Aging a lot because it's like a one-stop shop. They have case managers there that they can, hook up with, and the case manager can help them with, all kinds of needs, anything basically. So it's we just try and link them with the proper resources and give them the information just to make their lives a little easier.
Now, do you have a sense of how someone who can find out whether their employee has this sort of support?
Say that again?
Yeah, how can another employee at a different company find out about this sort of support?
Okay, well, hopefully they have an EAP at their company, and I would hope that their EAP would be able to provide the same resources and referrals and information that we do here at UB.
And do you have a sense of whether those employee assistance program support extends to immediate family members as well as the person who's working?
Yes, yes, it does. So if your parents are struggling or you're having a tough time with the conversations with them or they're being resistant, if they're open and willing to contact us, we would be glad to have a conversation with them and, try and help them too through it. Because I know for a lot of parents, it's the biggest thing is the loss of independence. And I think, just recognizing, relinquishing some of that independence is really hard. So just being an objective person, not a family member, to listen to them, to help them, validate them, understand what they're going through, I think is beneficial.
Okay, thank you.
You're welcome.
We'll move on to Randy. Randy, I'm wondering if you can talk about how your department addresses the unique needs of sandwich generation caregivers who are often balancing the demands of parents and the needs of parents and kids.
How's this? Yeah, there we go. Yeah, thank you. And thank you to Greg Olson for getting us a head start on that conversation. At the Department for the Aging, we have tremendous resources for caregivers. Our major challenge is connecting with those caregivers, being found by those caregivers. But once we're able to make that connection, we have a number of resources. We're always looking for opportunities for respite for those caregivers, to give them a break. One of our best tools for respite is social adult day programs. There's several throughout Erie County where caregivers can take their loved ones for the day, where they're going to receive socialization, nutrition, and sometimes assistance with activities of daily living, such as bathing and eating. We also are a participant of the Exhale program, which is currently underway in Western New York, a program sponsored by the Health Foundation for Western and Central New York with support from the Ralph C. Wilson Jr. Foundation, where they're supporting community organizations who are building programs to serve caregivers. These may be sporadic respite programs, which may meet once or twice a month to help caregivers. In addition to that, we refer folks to mental health counseling. My first involvement with the Department for the Aging was as a volunteer. Earlier today, we heard about the Powerful Tools for Caregivers program. And when I volunteered, I thought that was about training caregivers in the technical skills that they would need to be a better caregiver. What I quickly found out, it was training caregivers to have the emotional skills that they needed, the self-care priority that they needed to be the best caregivers that they can be. Counseling, therapy is an important part of tools for a caregiver. Options counseling. So anybody that calls our office at 858-8526, that's our New York Connects number, they're going to receive options counseling, and it's going to be different depending on what their situation is. We take a person-centered approach to serving older adults and caregivers. So these case managers that are referred by employers, see our information in the community, they're going to walk that person through all the options that are available and might work for them. As part of that counseling and a person-centered approach, I think that what we bring to the table is we recognize that a sandwich generation, you have different sandwiches. So let me give an example of what we'll just call the basic cheese panini. Very thin sandwich, a lot of pressure on the older generation, the younger generation. Certain populations and communities have a much higher prevalence of chronic disease, a much lower life expectancy. Children who are suffering from the effects of lead paint in their environment. Children who do not have the nutrition or educational opportunities that they need. That sandwich looks a lot different than the turkey club. Lots of layers, lots of support, lots of rich nutrients, and sometimes 3 or 4 generations that are working together to take care of the caregiving needs. You have longer lifespans, more resources. So that's an approach we take for folks when we're doing that options counseling to see exactly what the situation is that they're looking at, but it also is an important element of our planning long-term for the department.
And you mentioned that, and then we're also talking about grandparents potentially, having to be in this situation of older relatives stepping in to raise children. And then you have a situation where you have teenagers maybe helping to caregive for parents who have disabilities, or for grandparents because maybe a parent is out working. Are there special programs for folks like that?
So we offer this very similar caregiver support to those folks that may be in those specific situations. In addition to that, we have special programs for, it's called kinship caregivers. So it's a grandparent raising a grandchild. And we're seeing more and more of these situations arise. I think the multiple spikes locally in the opiate epidemic has contributed that dynamic. More grandparents who now have grandchildren that don't have an available parent in the household. So we refer those folks to the specialists, the folks that were on the previous panel, because those kinship caregivers, not only are they trying to figure out how to feed and get those kids to school, how to deal with the drama and dysfunction that's brought to their family by the person in active addiction, but they're also navigating the family court system. And that is a difficult system to navigate. So when those folks call us, we're able to refer them to the Center for Elder Law and Justice, and they have great attorneys that can, help them navigate a very difficult decision, probably making the toughest decisions that they've ever had to make.
Now, this is one way to take the load off of a sandwich caregiver. As far as I'm concerned, I'm going to be 65 next month, right? I've gone through some of the caregiving situations that we've talked about, but I'm getting older. And I'm worried about all of the things that maybe some of your parents out here are worried about. And I lean pretty heavily on my friends. So we have the same conversations about how many years do we have left? Are we going to end up in a nursing home? Is someone going to be diagnosed with a terminal illness? And trying to navigate all that from our standpoint. That kinship, that friendship really matters. That your department, I think, has some enrichment type opportunities for people who can plug in to certain either speaking organizations or learning organizations or those sorts of things that can help keep parents who are moving into some challenging years healthier, more occupied, more hopeful.
Yeah. So, I think when you look at the opportunities that people have to connect with those groups that you described have changed dramatically. My grandparents, their third place was the tavern, a weekly trip to the hairdresser, maybe a weekly bingo game, and communities were built for connection. That's changed dramatically. There's a real challenge when it comes to finding a third place, and we offer that through our partners at our local senior centers. Those could be municipalities that have a senior center, a nonprofit organization that has a senior center, or a community center. That's where those relationships are given the opportunity they need to grow. The programming that we bring into those senior centers is often focused on issues like this, but it's also attractive recreational social opportunities. And our struggle at the Department for the Aging is to have the opportunity for people to get to know us before they need us. So bringing them into the senior centers for our congregate dining program, for our University Express classes, gives us an audience that knows how to connect with us when they need that help.
We're dealing with maybe a sibling or somebody else that's just not on board with the way things are going. Do you have any suggestions for?
Yeah, it's difficult. Especially when the person that is receiving the care is not on board, and I think it's an important conversation to have. The major difference in these situations is if we're talking with folks who have experienced cognitive decline or may lack the capacity to make decisions. I can share my personal experience. My father passed away 7 years ago. And for half of his adult life, he was a heavy drinker. For his entire adult life, he was a heavy smoker. He was a type 1 diabetic who ate a half gallon of ice cream whenever the heck he wanted to. Exciting childhood. He was a great guy, don't get me wrong. But when he hit 65 and it became apparent that COPD was taking control, COPD was making decisions for him, I would offer my advice. I would tell him what I thought he would do. He didn't listen to his doctors for 50 years. He wasn't going to listen to me. I had to come to terms with the fact that his autonomy took precedence over my grief, my sadness, my anger. That's a major challenge. And that really throws a wrench into the family dynamics when these situations are taking place. That's why the counseling, the peer support are essential for people and families.
County use better to support families that are juggling multiple caregiving roles?
People shared some population statistics today. Over 75% of the people that have lived past the age of 65 in the entire history of the world are alive today. We're on the cutting edge. We've never had to deal with these problems before. The Older Americans Act really set a framework, a focus on these needs in this population. The Affordable Care Act brought funding opportunities to pay for the interventions that we really know work. So the innovation is needed in our approach. The innovation is a person-centered approach, looking at the differences in communities, different strategies to reach these communities, as well as a trauma-informed approach. We're talking about family dynamics, but we're really talking about childhood trauma bubbling up when difficult decisions have to be made. It's an important part of the conversation. So bringing those lenses to the work that we already do, that we already know is effective, is innovative.
Thank you. And this seems like a good time to move on to Andrea. Now, what are some of the most common challenges that you see people in the sandwich generation facing when caring for an aging loved one with dementia or Alzheimer's?
Sure. So working at the Alzheimer's Association and supporting families who are facing Alzheimer's or another type of dementia, I mean, and probably this is across the board. I mean, what we need more of is time, right? I mean, time becomes your greatest luxury when you are providing care for people, especially when that's coming from multiple angles. As a sandwich generation caregiver, I was thinking to myself, Scott, that when I met you, I was footloose and fancy free years ago, and now I'm in the sandwich generation in a sandwich generation caregiving situation myself, and yeah, time becomes your most valuable resource. So I think for organizations like ours, it's finding ways to meet caregivers and support their needs while recognizing the tremendous time constraints and pressure that they're under, and how easy it is to not prioritize self-care and just become really task-oriented and task-focused.
Can you talk about what happens when someone does come in? Do they come early early enough? And regardless of when they come in, what's the process of helping them plan better, take care of themselves better?
Sure. I mean, I think, there's a range. I know that historically speaking, now we have some new effective treatments for Alzheimer's disease specifically that are really valuable and truly only useful for folks who are diagnosed when they are early on in the disease process. Some of the new FDA-approved drugs that have come out in the last couple of years, they only work for people who are still very early on. So when we do reach folks, and have the good fortune to connect with folks who are early on in the disease process or have just been diagnosed, I think that it's a matter of helping them prepare without overwhelming them. But I think in that early stage in particular, there's a lot of opportunities. So it's a great time to put your affairs in order. And when I say put your affairs in order, I mean, certainly we're talking about having conversations with your loved one who has a cognitive impairment, having conversations with them about what their care wishes are for the future, making sure that you're on the same page about who they want to be their power of attorney, who they want to be their healthcare proxy, what their end of life wishes are. Talking through, there's this great resource called the Conversation Project, talking through what they want their end of life experience to be like, what their priorities are, what a good quality of life looks like to them. Having that conversation with the person who has a cognitive impairment when they're still able to actively participate in that conversation and give clear answers. It becomes trickier if time goes by and they're no longer able to have those kind of honest and open conversations anymore. Though let's face it, I mean, talking about tricky families that you encounter and people who value autonomy over anything else, there are some people where like no way, no how at any point in their lives are they willing to have that sort of conversation, right? And that can be a really tricky thing. So, I think helping families understand what options are out there, what services they can connect to, and what sort of things they need to sort of prioritize at this point in their journey. We often will connect folks with the Erie County Department for the Aging or another similar office for the aging in the area, whether it's Niagara, Chautauqua, Cattaraugus. We serve the 8 counties of Western New York. So we connect with the offices for the aging all over the place. But I think just, meeting that family where they're at and finding out what their priorities are, finding out what their pressing concerns are at the moment, and then just letting them know that at the Alzheimer's Association, we have free programs and services, and we offer family care consultations in person or over the phone. We have a 24/7 helpline. And so let's deal with what you're facing right now, and then when things change, as they always do with Alzheimer's and dementia, because these are progressive illnesses, then you come back to us and we'll have this conversation again. We don't have to figure it all out right now. We can have multiple conversations as things move along, because you can't really predict what's coming down the road. You kind of have to take it a day at a time. But another thing, the conversation about getting your affairs in order, I think it's also important for caregivers to do that as well. Make sure that anyone over the age of 18, we should all establish our healthcare proxies. We should all have conversations with our loved ones about what our wishes are, end of life decisions potentially, because heaven forbid, any one of us could, get hit by a bus any day, right? So especially when you're caring for others, making sure that your affairs are in order too, because oftentimes we think, all right, I'm the person who has everything under control, but what if something happens and you're not there to make those decisions? Making sure you've got plans in place just in case.
Can you talk a little bit about the red flags of memory issues?
Oh, sure.
And when families notice those memory issues, what first steps they should take?
Mm-hmm. Absolutely. So with Alzheimer's disease, and please forgive me, it's kind of pressure having a physician up on the stage here. I'm sorry, PhD. Okay. Whew. All right. Well, being in the medical school, there's a little pressure here as a art therapist by training to explain this. But where Alzheimer's disease first takes hold is an area of the brain called the hippocampus. And that's where short-term memory lives, where recent events are kind of recorded and stored for later. So people who are developing Alzheimer's disease in particular, oftentimes what we'll see in those folks is difficulty remembering recent events. So I worked in nursing homes for many years, and I often had the experience where I could talk to someone with Alzheimer's disease about something that happened 20, 30, 40 years ago, and they could tell me what the weather was like that day, right? That long-term memory lives in a different part of the brain, and that stays intact for a long time, well into the course of the disease. But if I would ask that same person about what they had for breakfast, they wouldn't be able to tell me if they had breakfast at all. So I think that's kind of a confounding thing for families, where they'll say, well, they remember some things really well, but other things not so much. There are certain things that will stick. But if a person is showing signs of difficulty with their short-term memory in particular, I think for Alzheimer's, that's a warning sign. But there are over 100 different types of dementia, 100 different dementia-causing illnesses. And the initial symptoms with those diseases can look different. So it might be difficulty with language. People are really struggling to communicate. Their vocabularies are shrinking, and they're having a hard time getting their ideas out. It may be a change in behavior, where suddenly the person is acting really impulsively and making strange, poor decisions and potentially wreaking havoc on their family as a result. That can be caused by a brain disease. There's other conditions that there might be visual hallucinations or some Parkinsonian symptoms, kind of a tremor, shuffling gait, that sort of thing. So the tricky part, right, is that it looks really different in everyone. From one person to the next, it looks different. And all of our brains are wired differently to begin with. We all have different strengths. So there's not kind of a perfect snapshot of what it looks like, but if you're noticing a change, it's a good idea to get to a doctor. It's a good idea to start with your primary care physician. It may be something like a vitamin deficiency, or something like a urinary tract infection, or some dehydration, medication interaction that can be addressed relatively easily. But if your primary can't get to the bottom of it, they might refer you out for more testing, and might refer you to a neurologist, typically. they might refer you out to a specialist to get a little more insight into what is going on. But I think now more than ever, time is of the essence with these new medications. They're not right for everyone, but if you want the opportunity to potentially take advantage of them, again, it has to be done in the early stage. So it's a good idea to at least get to the doctor and get a feel for what might be going on.
So we've talked already during the conference today about how confounding and confusing the medical system, the healthcare system can be. In that context, I'm wondering if you can give me just a couple of what you see as the most underutilized resources available to caregivers here in the region.
Sure. I mean, I think the Department for Thinking, we connect folks to them all the time because they have so much to offer, and people may either not be aware of it or think that they don't qualify for some reason. So I would say definitely reaching out there is a big one. The Alzheimer's Association, we have a 24/7 helpline. So people can call anytime, 3 o'clock in the morning on Christmas Eve, someone will answer that phone. So we can provide support whenever it's needed. We have people with expertise on Alzheimer's and dementia. Need a mental health counselor to talk to, we can provide that at 3 a.m. and it's completely free. I also think the Center for Elder Law and Justice is a tremendous resource. And I think, reaching out to faith communities and community centers, I think I agree with what Randy was saying, having that community and building your support network, because that's something that I don't think is particularly strong for a lot of folks in our world today. I think we're more disconnected than we used to be. So building that support network, I think, is really important.
And speaking of community, I'll reach out to Allison, who is with the YMCA. I am a member, and I find as I'm getting old, have to be hospitalized at the Independent Health YMCA because they're older and working out. People who've lost friends as they've gone into some of the classes. And this is really, kind of a metaphor for what we deal with in life at the Y. So I'm wondering if you could talk about some of the wellness programs that address both the needs of caregivers in the sandwich generation and those of aging family members that they care for.
Absolutely, absolutely. Thank you for having me. Well, similar to Randy, we also are a recipient of the Exhale grant. So we are in the third year of our adult daycare respite program at our Southtowns branch. And I'm happy to say that we have secured funding to carry that program to the Independent Health Y branch. Very interesting. The insurance companies for seeing the need to be proactive and manage chronic disease. And our Encourage program, we call it Encourage Benefit for Both, is we started a respite program prior to receiving the grant, recognizing the need very heavily after COVID. A lot of our staff team has been with the Y for 10, 20 years, so they've grown old with these members and recognize the cognitive decline, and so we're being very proactive and decided to start this program. With the funding, we were able to expand to different levels and provide a whole nother level of opportunity of socialization for these individuals in the program. What we did see is that the caregiver needs attention too. So what we did in this third year of the program, we offer a second, so once a month the program's offered, the first Wednesday of every month. So if you want to see something spectacular and amazing, you can come to the branch and witness this program in action. Now on the third Wednesday of every month, the caregiver can stay with their loved one during the program, and it's an opportunity for them to socialize with the other caregivers in the program. Our program is structured where there are volunteers one-on-one with the loved one, the program, the participant. So that frees up the caregiver to socialize with the others, exchange information, and basically, along with that, we provide a membership to those families, the caregivers. So now we've entered into that, how do we help the rest of the family? So maybe while their loved one is in the program on that first Wednesday of the month, they come in and participate in a class. If they have a child, they can put their child in our Child Watch program. So we've looked at all the different angles, and we've also entertained what can we do outside of just providing Child Watch for them while they're there. So we have many other evidence-based chronic disease programs that we offer, but what we see with our seniors in our facilities is that the socialization is the key to their independence, along with participation in these programs. We have social clubs, we have Mahjong, we have, you name it, we're doing it. We're having all different organizations come in and speak with these people so they learn, right? You talked about learning about you before they actually need you to go to the office. So we are capitalizing on all of that, recognizing that there's a need in our branches, every one of our branches. We're also working with our urban branches to get out in their communities, because we recognize in the city branches, they are more trusting of being in their community center or their church. So how can we offer those programs in those locations? It's, we're doing a lot, and we're trying to coordinate so that our child programs coordinate with the chronic disease program, so that someone in the family has somewhere to go with their child or alone to exercise or participate in the Y.
I know I'm very excited, but very few things are good about getting older. This is the conversation that you have, right? Grandkids are one,
Yes.
but silver sneakers or some sort of a free gym membership with
Absolutely.
Medicare. I'm signing up for one of those tomorrow, so I'm very excited about it.
Yeah.
Do most people know about these programs and take advantage of them?
So our Silver Sneakers classes, specifically at the Independent Health Branch location, and if you're not familiar with it, it's got about 21,000 members. It's our largest facility. The Silver Sneakers classes have 140 literally, I don't know if you've walked past a gym and seen the number of participants in the classes. So it's very eye-opening, and that's how we tell them about our special programs in those programs. Those instructors that they love so much are the voice for us to be able to communicate within the Y community. We do outside the Y, we do Fitness in the Parks program. That's another opportunity for us to promote not only the YMCA, but those chronic disease programs. And many people don't know this, but we offer Live Strong at the YMCA, which all of our chronic disease programs, when you participate in those programs, you do not need to be a member of the YMCA, and they are free of charge. Typically, most programs run 12 weeks to 16 weeks. You will receive a family membership for those weeks while you're in the program, so that your family can participate with you not only while you're in the program, but outside the program, because we recognize that the best results happen when you're with the one you love.
And are there other intergenerational programs where someone might be able to bring in their kids and their parents and
We
work
do.
out together, do some other socializing together?
So we are working on family programming. We wanted to start a family recess program over the summer, but with summer camp and just busy schedules, we decided we would relaunch in the fall and the new year. But we do have family craft. We do all different types of programs similar to that, where they can participate and it can be multi-generational. Even in the sporting things for the little guys, you see the grandparents sitting in the gym watching their grandchildren play. So it's an outlet for a lot of people in a lot of different ways. Again, we recognize the importance of the community partnerships. And so in our strategic plan, it is healthy communities and making sure that we're developing those partnerships on a regular basis, so that if they need services in the Y or outside the Y, we can help provide them.
And what are the biggest barriers you found that prevent adults who are caring for both children and older parents from engaging in some of these offerings?
I think sometimes they're not aware of the offerings, so doing a better job on that. But typically, I think it's a time restraint for a lot of those parents, because typically they have their children in our before and after school care programs, which we do provide extended care on both ends of the day if they have their children in care. But we recognize that if we regularly offer the parent night out and the kids night out, that they can utilize any one of those services. But I think it's a time restraint, and then sometimes they just don't have the proper referral system to get to the, we do recommend as best we can, especially in the Exhale program, the Encourage program, but we know that that's been a barrier, and hopefully with more community partnerships, it'll become easier for us to provide that information.
And do you have or do you envision any programs? We've talked about mental health and the importance here in caregiving and just making it through these days, right? Do you have any or envision any programs that would support child's emotional well-being, help them build some resilience with what they're dealing with here?
I think more family-focused physical activity programs, and that's on the agenda for us to develop and implement those programs. I think that the arts programs, obviously art is therapy, right? That when they're with, I don't want to call it a distraction, but they're expending energy and enjoying the time with the other children and families that they meet makes a huge difference. So more of that, more family activities. So I envision that. As far as the mental health piece, that's a little bit of a specialty that I think we would start with a referral recommendation type thing. But again, we do the best we can. Our goal for all our members and any community program members, you don't have to be a member of the Y to participate in the program, that we develop a relationship with them and meet them where they're at and see how we can help them.
Okay, thank you. So moving along, I know my mother-in-law, one of her two of her biggest goals as she was aging into her 80s, where she wanted to die at home and with all of her teeth. She was able to do that, but it took a lot of work from the family, from caregiving. Priya, you're an expert in this area. You've been working at it for 25 years or so. And I'm wondering, from your perspective, what is the most pressing challenge that families face today when caring for an aging loved one?
First of all, I want to mention that Allwell is the home care agency that you were just referencing, and that's exactly what we did. We allowed people to stay at home, to live at home, to have the comforts of home, and have their teeth as well. But the reason why I'm here today is because of something that evolved because of Allwell. And what happened was, because we're in the home care business, we would get calls every single week from someone in our network asking about what to do about their aging parent, a parent that they were noticing differences in. Now, all these resources, I need to have coffee with each one of you. They're all there, but people are not, like you said, not aware or just not reaching out for whatever reason. And so we would get calls, usually frantic calls about, I don't know, I've just been noticing this over some months, and I don't know where to start, what to do. Now this happened, and the expectation that was put on us was that we would be able to patch up a sort of a plan of care very quickly and put that in place for this person who was calling us. And sometimes we could do that and sometimes we couldn't. And so finally, we like to joke among ourselves, like, I have 3 people over here, my own cheering squad, right there in that row. Hey, guys. So finally, we got together and I'll tell you who they are in a minute. We got together, myself and my business partner and our CEO right there in the blue sweater, and we said, we need to do something about this. People are asking these questions all the time. People don't know where to start with the caregiving piece of it. So almost 3 years ago, I'm thinking, we engaged a venture studio, Dragonfly, who are with us right now, to develop a technology-based platform where the other thing that we realized was when people are looking for information on something, what do they do these days? They pull out their phones. Like we live on our phones, right? And that's a separate discussion, which is a problem right of it, by itself. But they pull out their phones and they start to Google or use some sort of AI to come up with an answer to their problem. And what we realized was people needed a planful, cogent way of organizing their caregiving plan for their mother or their father, specific to them, specific to the zip code that they live in, and specific to the debilitating condition. And so that's why we started Care Engine, which is why, so what you mentioned was my earlier experience, which led to this. So we are in the commercialization phase right now, and we're hopefully launching early next year. And this will afford a platform for people to be able to approach caregiving in a very planned way, and hopefully be able to access all these resources as well. So the biggest challenge, in caring for people is not knowing where to start, not knowing that uncertainty that comes with, how do I put this together that makes sense for me?
And what would you say for people who have this goal, and a lot of folks who are getting older, it all comes to the independence, right? They want to live at home. What are the key elements they need in order to stay in their homes?
Well, that is, part of what we do on the Care Engine platform is be able to stay at home. Are you looking for just knowledge about this particular condition and where it could take you? What are you looking for? So we're going to tailor that plan, depending on what path you're taking, to be able to come up with the best possible answer to that question.
And I don't know, I mean, it's because you're going to need money, right? You're going to need some of the advisors that we've had. You're going to need legal help,
Yes.
and you're going to need a team. So can you talk just a little bit more about the elements? I mean, are there a couple, three things that seem pretty uniform?
Well, we need all the things that you mentioned and then some. So we have many different pieces that are working all at the same time. One of us is working with user experience. What does it look like as I'm navigating my way through this app? One of us is working on, talking to people like you, because we need those resources as part of our database. And I am looking for people who are interested in investment, and this means something to them. Because, a lot of people have mentioned that they have experienced this exact thing, and I needed you 3 years ago. I needed you 5 years ago. So all those pieces, the legal advice, we are very much aware and cognizant of all those pieces, Cotton, how they all need to come together to make this viable and something that can be used. So we're starting right now with Western New York, but then eventually national. So you can
you want to keep people in your home, but when do you know, when should you know that it's time for mom or dad or another loved one uh, to get more advanced care, either an assisted living or a nursing home?
Mhm. I think in the Care Engine platform, that is, there's the opportunity for a collaborative discussion between you and your family members. Everyone can be involved in it. So it's a platform that, say, you may start planning for your mom, but then you can invite your siblings into it. And that point may come where, if all this planning that has taken care at home is now no longer making sense, then everyone on that platform is talking about that together, and would then probably come to the point where they say, what's the next step? And we would be able to link you up with the resources you need to be able to make that decision. Because sometimes I don't know what the answer is to the next step. I need someone to advise me on that. So we've had some great resources today that, we took the names and numbers of. I'm going to need them. So, we can't do this alone. We can't do this alone. We all need support in doing it.
Does anybody else want to talk to that as well?
I think when I have this conversation with families about when it's time, I think one of the key things that I try to help folks understand is that timeline has less to do with the person who is experiencing the older adult who is experiencing the decline. It has less to do with sort of where they are and their progression in some cases than it is what the family can support. It's what the caregiver, I think it's drawing the line for the caregiver in terms of what they can manage and what they can handle. It's less, waiting around, waiting for it to get to a certain point for their loved one. It's a decision that you have to make for yourself in terms of what you can reasonably manage. And that, I think, can take some of the mystery out of it. I think there are some families where maybe, there's, one of the daughters is a nurse or something like that, and they can keep their loved one at home until the very end, and that's great. There might be another family where there's that same arrangement where the daughter is a nurse, but maybe the daughter and the person who's receiving care have always had this contentious relationship where they just fight like cats and dogs. And even if they could physically provide the care to keep their loved one at home, it may not be a good situation for either party. And so it's about, giving the caregiver permission to draw their own line where they need to, less than kind of the disease progression.
Okay, I think we've reached the allotted time. I will say that I have provided to Jill a list of resources here in Western New York from the national, state, and regional level that I think she'll be able to share for anybody here or listening on Zoom. I'll let her to come up to that.
Okay, thank you to each of you for joining us today and representing your organizations and all the wonderful things that you're doing in our community so beautifully.